We're really happy to be involved in research studies here on broad fronts for orthopedics. And one of the things that we're doing that's really exciting, that we've been doing in professional athletes for some time, that we're trying to prove works for everybody, is using a drug may make fractures heal faster. So I can get an elite athlete who has a fracture that might take 6 or 8 weeks to heal, and with the drug we're hoping that we can show that they may be able to heal in 4 to 6 weeks instead of 6 to 8, which gets them back playing faster. This drug is something that's in common use now for people who have osteoporosis. And that drug, though, does affect the remodeling and the healing of bone, so that we're hoping that it shows that fractures heal faster than they would without the drug.
One thing that put a lot of ease in my mind was it wasn't a brand new drug. We think that my healing time was sped up so much, and I was actually able to walk 4 weeks earlier than what I would have, or what the average time is for this break. When I thought of people down the road who have this fracture, I will be able to say that if this is actually used, I'll be able to say that I was a part of this.
I'm Dr. William Fitz at the Ohio Orthopedic Center of Excellence. I'm a physiatrist, which is someone who specializes in the non-surgical treatment of back and neck pain. Well, one of the other research studies we're doing here is a study that I'm conducting to see if hyperbaric oxygen therapy will help people with chronic back pain. There are patients that we have who have degenerative discs in their back. Some of these go on to surgery. Many of them, surgery is not a good answer for them. So we're left with this chronic pain that we have not been able to help. We know that tears occur within the disc, and these tears will not heal in all people. So this treatment is to try and induce healing that has not occurred to that point. When a patient goes into the hyperbaric chamber, what goes on inside there is 100% oxygen is fed into the chamber, and so they'll be breathing that in. The treatment is occurring inside their lung as the pressure pushes the oxygen into the plasma of their blood, not actually the red blood cell. The red blood cell already is coated with plenty of oxygen molecules in breathing normal air. We're pushing oxygen into the plasma to deliver more oxygen at the tissues that don't have oxygen. The disc is one of the most poorly vascularized structures in the body. It does not have a good blood supply, so it does not have a good oxygen supply either.
My name is Dr. Joe Maletti, and I'm a shoulder specialist here at the Ohio Orthopedic Center of Excellence. And my specialty, as stated, shoulder and elbow, upper extremity surgery, both adult reconstructive type surgery, in addition to traumatic injuries. Most of the studies that we're doing on the shoulder here at Ohio Orthopedic Center are related to shoulder trauma and different types of devices used for shoulder trauma.
We have started these studies to try and help our patients. It does take time away from our practice. It takes funding dollars to pay for these studies. They're expensive often. And we do it because we're not satisfied with just what we've got. And we want to find something better to help the patients that we see. And if it helps our patients, help patients, outside of Central Ohio here.
Well, I think research augments physicians' clinical practice in many ways. First and foremost, it helps you contribute to your field and helps advance your field. If you are researching your patients and doing clinical research and studying outcomes, etc., it helps you see what are you doing right, or what are you doing that maybe could be a little better. What can you do to make the patient outcomes better? So ultimately, in all these different facets, basically you're coming down to doing what your number one goal of being a doctor is, and that's getting better patient care.
For information on research at the Ohio Orthopedic Center of Excellence, call us at 614-827-8700 or visit us on the web at www.ohio-ortho.com.